Hello everyone, this is Dr. Sangeeta Chaudhary. I am a consultant physician and again I welcome everyone to my lecture class. In today's class, I am going to discuss about general physical examination of a patient. So what are the prerequisites for general physical examination? First of all, before doing any examination, we need to take consent from the patient. And we need to explain what are the things we are going to do, what are the examinations we are going to do. Next, we need to really maintain the privacy of the patient, and patient should be examined in a clean and quiet room where there is good ventilation and good amount of light is there. And if a male doctor is going to examine a female patient, then it should always be done in the presence of a female attendant. Okay, so these are the things which should be maintained or which should be done before going to examine a patient. So how we do the general physical examination? First of all, we need to stand on the right side of the patient after taking consent and after doing proper explanation of what we are going to examine. Then we are going to comment on the general well-being of the patient. And how do we comment? We say that the patient is conscious, cooperative and well oriented to time, place and person. This is the comment on general well-being of the patient. Next, we are going to comment on the build of the patient and nutritional status of the patient. The build can be of an average local build. Okay, we need to compare the patient build with the local population and then we can comment. Okay, and then we need to measure the patient's height and weight, and we need to calculate the BMI of the patient, and we need to comment on the nutritional status of the patient. Okay, so after commenting on nutritional status, we are going to proceed with the vital signs. So what are the vital signs? There are 4 vital signs which we are going to measure or we are going to take a note of. Okay, first of all, we need to check the blood pressure of the patient. Second, we need to check the pulse of the patient. Okay, then third, we need to check the temperature of the patient. Fourth, we need to check the respiratory rate of the patient. So 4 vital signs: blood pressure, pulse, temperature and respiratory rate. Regarding how do we check blood pressure or how do you describe blood pressure, how do you look for different characters of pulse or what are the subheadings in the pulse, these things I am going to discuss in my next class. So I am not going to go into the details of vital signs in this particular class today. So after checking the vitals, we are going to look for certain other signs which we also can refer to as head to toe examination. So what are the things we are going to look for? We are going to look for any sign of pallor, icterus, cyanosis, lymphadenopathy, clubbing, koilonychia, dehydration and edema. So these are the things we are going to look for in head to toe examination. Okay, again I am saying we are going to look for pallor, icterus, cyanosis, lymphadenopathy, clubbing, koilonychia, dehydration and edema. So each of the sign I am going to discuss in my next classes. Okay, and two more important things we are going to look for in the neck in the general physical examination. Firstly, we need to look for the neck veins, if there is engorgement of the neck veins or not. If there is engorgement of the neck veins, we are going to take a measurement of JVP, jugular venous pressure. Regarding the JVP, I have already discussed in one of my classes. Okay. And after that, after measuring the JVP, one more important thing we are going to look for in the neck is thyroid swelling. So we will look for if there is any thyroid swelling. If there is a swelling, then we are going to describe the swelling. Okay. So this in short completes the general physical examination of a patient. Again, I am repeating, first of all, we need to comment on the general well-being of the patient. And how do we say about the general well-being? We say like the patient is conscious, cooperative and well oriented to time, place and person. Then we will comment on the build of the patient, nutritional status of the patient. We will take a measurement of patient's height and weight. We will calculate the BMI. Okay. How do you calculate the BMI? BMI is weight in kg divided by height in meter square. Okay. Next, we are going to look for the vital signs. There are 4 vital signs: blood pressure, pulse, temperature and respiratory rate. So after recording the vital signs, we are going to do a head to toe examination and we are going to look for any signs of pallor, cyanosis, icterus, clubbing, koilonychia, lymphadenopathy, dehydration and edema. And in the neck, we are going to look for 2 things. We are going to see if there is an engorgement of the neck veins or not. If the neck veins are engorged, we are going to take a measurement of jugular venous pressure, that is JVP. And if we are also going to take a note if there is any thyroid swelling, any swelling in the neck. Okay. If there is any swelling of thyroid gland, we are going to describe the swelling again. Okay. So in my subsequent classes, I am going to talk about how to record the vital signs and how to describe the vital signs, and also about each and every sign of head to toe examination. Thank you so much for attending the class. I hope it was helpful.